Many thanks for staying with us here on News Desk. To some more issues now. And global epidemics such as Ebola, which some countries in the sub-region experienced recently, affects the socio-economic, political and security of these countries. But is there a way to turn this negative happening into a positive thing for our countries? The Roundtable Policy Dialogue on the Threats of Epidemics seeks to answer these questions. In studio to help with this very discussion is His Excellency Jeremiah Haile, Country Director, Joint United Nations Program on HIV and AIDS, and he's here with me in studio to help us really understand how it's going to work. Mr. Haile, many thanks for joining us. Once again, good to see you again.
Thank you very much. It's wonderful to be here again.
But really, how do we as countries that are usually affected by some of these things, how do we benefit from such programs?
Well, at this point in time, we're talking about opening a space in the policy dialogue. Usually when we talk about epidemics, we tend to focus more on the health issues and the health causes as well. But beyond the health, there is always a bigger impact in terms of epidemics, because epidemics are wide. They cover big areas. Sometimes they're even cross-border, and in many cases also affect a very vulnerable population also. So when we are talking about this issue now, we are saying, to what extent have we created sufficient amount of space in our policy dialogue to consider these other issues that eventually actually impact even more seriously on the country and the society than just the disease itself? And this is what we're trying to do in this. We have seen HIV and AIDS. We have lots of lessons that we have learned from HIV and AIDS. And based on those lessons, we're also now questioning whether our preparedness for Ebola and maybe even the Zika virus, all these epidemic-based viruses that are coming, whether we are adequately prepared for them. What is the consequence for us as a country, for us as a continent, that we need to look into in order to prepare ourselves, if, in a situation of eventuality of these epidemics.
So I'm presuming there was a problem identified somewhere, hence the decision to hold this dialogue?
Well, you see, we are in borrowed time in Ghana, so we're using this time to really prepare the country and all the partners in terms of understanding the lessons that we have learned, especially in the 3 countries in West Africa on the Ebola-related issues. And Ghana was also directly involved in 2 ways. First, it had become the hub for the response for the Ebola, and at the same time also it had undergone its own national preparedness plan, which mainly supported the preparedness of the health sector. And given the situation in Ghana and available health sector, it is a resilient health sector that is strong enough to withstand any kind of the proportion that we have seen in terms of epidemic. But as you know, epidemics don't happen in hospitals. True. They happen in communities. So if the community is not ready, if the bigger impacts have not already been understood and already anticipated, then all those that are going to be affected will not be in a position to support the health sector's preparedness to succeed. So this is what we are doing now. So we're expanding the policy dialogue. Okay,
but looking at this issue of Ebola, yes, we do know that elsewhere the numbers have come down drastically, but with time the numbers go up a bit and then they come down, and then we say, okay, Liberia is Ebola free, then after a while we see 1, 2, 3 cases and it goes up a bit and then it comes down again.
Still you are dragging me to discuss the disease, which is fine.
I didn't want us to go so much into it, but it just keeps coming.
The disease, yes, you see, it is a virus. And we're also learning more and more about it now. First, we thought this is a virus that will quickly die, but now we're learning several months down the line, it is still active. So the level of response which is already in place in those countries is able to quickly identify whenever there is somebody who is being infected by Ebola or being suspected of Ebola. So we have that in place. But what we don't have in place in terms of policy dialogue for the other countries is, if something big like that happens, now it's going to have a ripple effect on everything else. The livelihood, the markets, the services, the stigma, the community, the culture, everything is going to be affected. For instance, one of the issues we say about Ebola is not to touch, because it is transmitted through touching. How now do you explain this to a mother who has small children, whom she has to feed, whom she has to clothe, whom she has to wash, and then you're still telling her not to touch? This is where we have not been able to break it down yet.
Okay.
And this is what we want to talk about.
Okay.
And say, assume there is an epidemic, and all of a sudden all the people who are getting sick are being taken to the hospitals. And now people start to get afraid to go to hospitals.
True.
And then people don't want to go there to deliver babies, they don't want to go there for treatment. And then the same epidemic also comes, manifests itself in schools. People don't want to go to school. People don't want to go to markets. People don't, then what happens?
Essentially the whole...
Yeah, the whole system
crumbling.
crumbling. So this is what we're saying. So this is the kind of discussion we need to have. I think we have understood enough of the health implications, but we have not understood enough of the political, economic, and security and cultural impact
Fantastic
of
idea,
of
really.
Yes.
So let's look at the persons who will be speaking at this very event and what went into considering these individuals who will be giving keynote addresses on this very dialogue.
Yeah, it is. This dialogue is a very balanced one.
Okay.
But more balanced this time because we have now brought out these other aspects.
True.
So we'll have somebody who will be talking about the socio-cultural effect and impact. We have somebody who will be talking about the economic impact. We have somebody who will be talking about the security and political impact. And we'll have somebody also who will be talking on the health policy as well. So, and I'll be speaking there in terms of, what experiences and lessons have we learned from the HIV and AIDS response globally. So this is what now we have assembled. So now, as far as we are concerned, even though this is a maiden policy dialogue, it is a 360-degree dialogue it's going to be, and we expect quite a number of policy makers, researchers, and also opinion leaders to be there as well.
I will try and be there.
Yes,
when is it today or tomorrow?
Today at 3
today.
o'clock, yes.
Today 3 p.m.
At the World Bank.
At the World Bank.
Yes, on Independence Avenue.
Okay. Okay. All right. I'll myself I need to pass by because I think it's a pretty interesting thing we need to talk about.
Excellent.
So many thanks for your time on Newsdesk this morning.
Thank you very much.
Hope to see you this afternoon later.
Okay.
Jeremiah Hailey is the country director for UNAIDS and he's helped bring perspective to that very issue. And if you didn't know, that very dialogue is this afternoon at 3 p.m. at the World Bank. If you can, please pass by. I will also, like I said, try and pass by and get to learn a lot more about that very issue. But let's move on now to some politics. And founder of the Progressive People's Party and businessman Dr. Papa Kwesi Ndum has taken a swipe at the Institute of Economic Affairs for its intention to organize a debate for the frontrunners of the November elections. The IE on Tuesday revealed that it is considering a separate debate for the NPP's Nana Akufo-Addo and the NDC's John Dramani Mahama.
I heard over in the media that some people say they want to organize some debates, so presidential debates. And then when they are organizing debates, they say, oh, we want a debate with parties with representation in parliament. And I keep asking, what sort of an animal is that? There is no such thing in law. There is no such thing in the political parties law of parties with representation in parliament. And now somebody also is saying that, oh, maybe they will do a debate with John Dramani Mahama and Nana Akufo-Addo. And I said, is that where we have gotten to in Ghana? You know, we had an election in 2012. And someone came second. And to borrow some words from Nana Akufo-Addo, all laws be laws. If somebody lost by 5 million votes, someone lost by 5 votes, it's all loss. So how does that entitle somebody today for someone to say that, oh, that person should go into a debate with somebody else? Somebody is president today. But who should say for you and I that that person is doing such an excellent job that he deserves to be standing there to be part of a debate? It doesn't work. Everybody starts off with 0 votes. And you don't know who will bring the best idea in a debate, in a discussion. or you don't know who will fire the imagination of Ghanaians for people to say today that, we may have voted NDC and NPP in the past, but today we have changed our mind. And we vote for people.
Well, he's also unhappy with the Electoral Commission for not doing much towards having a credible voters register for the upcoming November polls.
You know that there are 25 political parties in Ghana. It's not true, because most of them, they don't meet the requirements. So why do we have an institution we call the Electoral Commission? There are laws, and the law gives them teeth to punish anybody who doesn't do what is required of them, and yet they have refused since 1992 to remove political parties who don't do what they are supposed to do. Now, when you don't have discipline, one of these important institutions, then the results that you get, they are also indisciplined results. So it is important for us to know that there are rules and there are laws. There's a law that says nobody should go and take money from a foreigner to come and run an election. But who cares? Who reviews where the money comes from? If it comes from wherever, Russia, America, anywhere, whoever gives you money for a reason. If you give me 1 pesewa for me to go and run a campaign, you are hoping that something good will happen after that. So somebody who is giving someone millions of dollars to run a campaign in Ghana, they know what they are also looking for. But who is watching? Who is guarding? Who is making sure that only Ghana money is what we are using to run our elections?
And that was the 2012 flag bearer of the Progressive People's Party, Dr. Papa Kwesi Nduom. And we do know that that party, I'm speaking of the PPP, they will later this morning be holding a media briefing on quite a number of issues. We will be there and we'll be bringing you live updates as and when we do have them. Time now for another break here on News. When we come back, Emmanuel Abojiri joins us with business. Stay on.